Hello and welcome to all of you. So here we have come to discuss about some important topics of pharmacology and that are really relevant for your upcoming FMG exam. So we are here on the YouTube live session. You must have got the link also. So you can directly chat with me through this link. So I am there with you live session, face-to-face live session, face-to-face through this electronic media. So it's a live session, guys. So in case you people have any doubt, you can post it over here. So what we will do in this pharmacology discussion, we'll discuss some important topics which are relevant for your exam. So approximately 30 to 35 topics we will discuss today. Yeah, Dr. Idiopathic, good evening. So starting with question number one, I mean the topic number one. So topic number one, which is relevant for your exam, is cholinergic drug. So the topic is cholinergic drug. This is very important topic for your exam. So every year you can expect one MCQ from this topic, that is a cholinergic drugs. Okay, so the doctors are saying the voice is little bit low. So I request the technical team to work upon this. Okay, so we have taken your challenge. So I will tell my technical team to connect to increase this volume. So in case you people have any other problem, just let me know. Okay, yeah. Good evening, Dr. Shubhansh Singh. Yes, Dr. Abhinandan. Dr. Abhinandan, how are you? I hope you are doing good. Okay, so the topic is cholinergic drugs. So in this topic of cholinergic drugs, guys, please remember, whenever we give medicines like cholinergic drugs, these medicines can produce the action that we can remember with the mnemonic. The mnemonic is dumbbells. So these medicines can result in some actions that we can remember with this mnemonic, that is dumbbells. So here the D stands for diarrhea, U stands for urination, M stands for meiosis. So the medicines can cause diarrhea, urination, meiosis. Medicines can also cause bronchospasm and bradycardia. These medicines can result in lacrimation, salivation, and sweating. So all these glandular secretions are increased. We call them cholinergic drugs, right? So the topic is cholinergic drugs. That's the first most important topic for your exam. So medicines can cause diarrhea, urination, meiosis, bronchospasm, bradycardia. Medicines can also result in erection, lacrimation, salivation, and sweating. Now these medicines can be of two types. Medicines can be directly acting, medicines can be indirectly acting. Now the medicines which are directly acting, these medicines will directly act on muscarinic receptor, and by acting on muscarinic receptor, medicines can result in dumbbells as the effect in the body. Now, if we talk about indirectly acting medicines, now the medicines which are indirectly acting, these medicines are inhibitor of an enzyme. We call it acetylcholine esterase enzyme. So medicines which are indirectly acting medicines, they are the inhibitor of acetylcholine esterase enzyme. So when you inhibit acetylcholine esterase enzyme, the level of acetylcholine will be higher. And now this acetylcholine will act on muscarinic receptor and can result in the same action as dumbbells. So these medicines are known as the cholinergic drugs. Both medicines can result in actions like dumbbells, can be directly acting, can be indirectly acting. Now the medicines which are directly acting, here you should be knowing about this medicine. The drug name is bithenecol. So bithenecol is the first medicine which is a directly acting medicine. So you people have to answer where this medicine is used. The second medicine belong to this class is pilocarpine. So we have two medicines. One is known as pilocarpine, one is known as bithenecol. So where do we use this medicine? So guys, this you must be knowing. Bithenecol start with B. So this medicine is given to stimulate the bladder. So this medicine is given to stimulate the bladder. So this medicine is given for bladder stimulation. So bithenecol is a drug that is given for bladder stimulation. So this is the best medicine. This is the drug of choice for the atonic bladder. So whenever the bladder is atonic, so atonic bladder, this is the best medicine. This will stimulate the bladder. This medicine is bithenecol. Now this medicine is also drug of choice for post-operative retention of urine. Is the best medicine for post-operative retention of urine, where the medicine is given to stimulate the bladder. Right. Now we have a drug. The drug name is pilocarpine. Pilocarpine is a medicine that starts with alphabet P. This medicine can make the pupil pinpoint. So this is the eye drop. So pilocarpine is an eye drop. This will make the pupil pinpoint. Now who will tell me where do we use this pinpoint pupil? Like if a medicine can make you, if a medicine can make your pupil pinpoint, medicine is an eye drop. Where do we use this medicine? So this medicine is given for the treatment of acute angle closure glaucoma. We can use this medicine for the treatment of angle closure glaucoma. The drug name is pilocarpine. One of the important side effect of this medicine is peripheral retinal detachment. Side effect of medicine is peripheral retinal detachment. Now we have some indirectly acting medicines. Medicines जो indirectly acting है. These medicines are inhibitor of acetylcholine esterase enzyme. Now these medicines which can inhibit acetylcholine esterase enzyme, these medicines can be of two types. Medicines can be reversible inhibitors. Medicines can be irreversible inhibitors. So medicines can be reversible, medicines can be irreversible inhibitors. Now if we talk about the reversible inhibitors, if we talk about the medicine that is a reversible inhibitors, so we talk about reversible inhibitors medicines. So reversible inhibitors में we have a first medicine pyridostigmine. Now can any one of you tell me where do we use this medicine pyridostigmine? Drug name is pyridostigmine. Where do we use this medicine pyridostigmine? Now we have a second medicine belong to this class. The drug name is neostigmine. So where do we use this medicine? Neostigmine. Now we have a third medicine belong to this class. Drug name is edrophonium. So we have a medicine edrophonium. Number 4, we have a medicine. Drug name is donepezil. Number 5, we have a medicine physostigmine. So can any one of you tell me where do we use all these medicines? So these medicines are indirectly acting medicines. So pyridostigmine is a best medicine, like many of you have already marked the answer. So pyridostigmine is a best medicine for myasthenia gravis. So pyridostigmine, best medicine for myasthenia gravis. But for myasthenia gravis, this is not used alone. This is used along with atropine. So this is used along with atropine. Now where do we use this medicine? Neostigmine. Yes. So you people have already given the answer. Neostigmine is a medicine that we use for the treatment of cobra bite. So this medicine we can use for the treatment of cobra bite. And in treatment of cobra bite, the first medicine to give is anti-snake venom. First we give anti-snake venom. After anti-snake venom, we will give the combination of neostigmine plus atropine. So cobra bite mein we give anti-snake venom as a first medicine. After that, we give neostigmine plus atropine combination. Now this medicine is also the drug of choice. Also the drug of choice for reversal. Also the drug of choice for reversal of skeletal muscle relaxants. So reversal of skeletal muscle relaxants like the medicines which are curiums. So medicines which are curiums, reversal of skeletal muscle relaxants done by neostigmine. So neostigmine is a medicine. This is also given for reversal of skeletal muscle relaxant asked in your recent exams. Now where do we use edrophonium? Yes, edrophonium is a drug that we use for diagnosis of myasthenia gravis. We use this medicine for diagnosis of myasthenia gravis because of the shorter acting drug. Now, who will tell me where do we use donepezil? None of you are answering the donepezil. I'll give you one hint. Donepezil is given for a condition that starts with alphabet D. Donepezil starts with alphabet D. It is given for a condition. It's a drug of choice for a condition that starts with alphabet D. So this is the best medicine for dementia. So this is the best medicine for dementia. So donepezil is the best medicine for dementia. Dementia is seen in patients of Alzheimer's disease. So we can say this medicine is a best medicine for Alzheimer's disease. So donepezil is a best medicine for Alzheimer's disease, starting with D, best medicine for dementia. Now who will tell me where do we use physostigmine? So you people have answered till edrophonium. Uske baad bhi beta medicines are written. So can you please tell me where do we use physostigmine? Physostigmine को कहाँ use करेंगे? Where do we use this medicine, physostigmine? I'll give you one hint. This medicine is antidote of one poisoning. So this medicine is antidote of which poisoning? Can any one of you answer me this question? Yes, physostigmine is antidote of which poisoning? Anyone can answer? So this medicine is an antidote of choice for, yes, this is the antidote of choice for datura poisoning, or we also call it a atropine poisoning. So this medicine is the best medicine for datura poisoning or atropine poisoning. So these medicines are the reversible medicines. Now we have a second class of medicines which are known as irreversible inhibitors. So which medicines are irreversible inhibitor of acetylcholine esterase enzyme? So these medicines are basically the poisons for human being. So these medicines which are irreversible inhibitor, these medicines are poisons for human being. One poison is organophosphate poisoning. Second poisoning is carbamate poisoning. So we have a organophosphate poisoning, carbamate poisoning, and during this organophosphate and carbamate poisoning, You will have the symptoms, that is dumbbells. Now to control the symptoms of dumbbells, that is due to muscarinic receptor. So all the symptoms are due to muscarinic receptor, organophosphate poisoning, carbamate poisoning. So which medicine we can use as an antidote here? So answer is the antidote of choice is atropine. So atropine is an anticholinergic medicine. This is an antidote of choice. Now, guys, can you please tell me, atropine is given for the poisoning of both the medicine. That's the correct answer. It's an antidote of choice. But there is a group of medicine oximes. So who will tell me, along with atropine, we also give medicine oxime like the pralidoxime. Now this is given for which poisoning and what is the role of this? What is the role of oximes? So oximes are given for which poisoning? Do we give it for organophosphate poisoning or carbamate poisoning? So you people have to answer me this question. Oximes are given for which poisoning and what is the role of oximes? So this is given for organophosphate poisoning only. So oximes are given only for organophosphate poisoning, not given for carbamate poisoning. And organophosphate poisoning mein we use oximes. And what is the role? The role of medicine is enzyme reactivation. This is useful for enzyme reactivation. So this is something very important for this year exam. ये आएगा आपको guys इस बार कि why we give oximes in OP poisoning. The answer is this is given for enzyme reactivation, and enzyme reactivation result in faster recovery. So this is required for the faster recovery. So this is required for faster recovery or enzyme reactivation. So this is something very important for your exam, particularly for this year exam, because this is asked in NEET exam also this year. So this was the first topic which is important for your exam. So topic number 1 we are done, that is cholinergic drug. Now let's move on to the next topic that is important for your exam. So topic number 2. So topic number 2 mein which the topic which is important is they can ask you the poisonings and their antidotes. So poisonings and their antidotes. So this topic is very important for your exam. So every year they will give you one poisoning and you have to find out the antidotes given in the MCQ. Right? So I'm just writing the names of poisoning. You people have to give me the answer. The first poisoning again I'm writing is organophosphate poisoning. So please tell me which treatment is the best treatment for organophosphate poisoning. Second poisoning which I am writing here is atropine poisoning, also known as the datura poisoning. What is the name of the antidote? You people have to give me the answer. Next is the scorpion bite. So whenever patient is bitten by scorpio, what is the best treatment that you will give? Third treatment they have asked you scorpion bite. Then they can ask you benzodiazepine poisoning. So what is the name of the antidote of benzodiazepine poisoning? Then they can ask you the antidote of choice for opioid toxicity. So opioid poisoning, benzodiazepine poisoning, this is important. Tricyclic antidepressants. So tricyclic antidepressant poisoning, which medicine we can use? Next is methanol poisoning. So which medicine we can give for methanol poisoning? Which medicine we can use for paracetamol poisoning? So paracetamol poisoning, which medicine is used? Next is what is the treatment of choice for methotrexate toxicity? Methotrexate toxicity, aspirin toxicity, phenobarbital toxicity. So anyone can answer the best antidote of all these medicines toxicity. One more is beta blocker toxicity. So toxicity of beta blocker. So what is the antidote of choice for beta blocker toxicity, where the examples can be the metoprolol. So metoprolol ka toxicity, which medicine we can use as an antidote? Okay, so I can see most of you are giving me the correct answer. So organophosphate poisoning, we people have already covered. We give atropine plus oxime. This is what we have covered. Here we give only physostigmine. So here we give only physostigmine as a best medicine. Now scorpion bite mein the first treatment. Scorpion bite mein first treatment is antivenom. So here we give antivenom first. After giving antivenom, we will give prazosin. So guys, don't make mistake in this. So we give antivenom. So antivenom is the treatment of choice, or you can write down like this way: antivenom plus prazosin combination. Now, what is the role of prazosin here? Prazosin is given to prevent. Prazosin is given to prevent the high blood pressure and the heart failure. So this is given to prevent heart failure and high blood pressure. This is the role of the prazosin. But please remember the treatment of choice is antivenom. Now for benzodiazepine toxicity, the best antidote is flumazenil. So flumazenil is the best antidote of choice. Now for opioid poisoning, the best antidote is naloxone. So everybody is answering correctly. For tricyclic antidepressant poisoning, here the best answer is sodium bicarbonate. So sodium bicarbonate is an antidote of choice. Now for methanol poisoning, For methanol poisoning, the best antidote is fomepizole. So fomepizole is the best antidote of methanol poisoning. Paracetamol toxicity, most of you have marked it correctly. That is N-acetylcysteine. So N-acetylcysteine, which will act like a glutathione in the body. So this will act like a glutathione in the body. So N-acetylcysteine is an antidote of choice for paracetamol toxicity. Now the best treatment for methotrexate poisoning, aspirin poisoning, and phenobarbital poisoning is forced alkaline diuresis. So forced alkaline diuresis is treatment of choice. So forced alkaline diuresis treatment of choice for methotrexate toxicity, aspirin toxicity, phenobarbital toxicity. Leucovorin is for prevention. Leucovorin is for prevention. It is not the treatment, right? So leucovorin is prevention. We also call it a folinic acid, like I can see many of you are marking. But the best treatment for toxicity is forced alkaline diuresis. So here the beta blocker toxicity, the best antidote is glucagon. So best antidote is glucagon for the beta blocker toxicity, right? One more toxicity I have left, that is digoxin. So who will answer me? What is the antidote of choice for digoxin toxicity? So digoxin toxicity mein they can ask you three questions. Digoxin toxicity can come to you with ventricular arrhythmia. So if they have given you ventricular arrhythmia, you will mark lidocaine, or they can give you heart block. If the case is of heart block, you will mark the atropine, or if they will give you the case of if they will ask you the unique toxicity or the unique antidote of choice for digoxin, then this will be the digibind. So digibind will be the unique antidote and unique uh, medicine that is given for this condition, that is known as digibind. So all these medicines we can use for digoxin toxicity. So topic number 2, important for your exam, is poisoning and their antidote. So this is very important topic for your exam. Now let's move on to topic number 3. So moving on to topic number 3. So the topic number 3 is based on medical emergencies. So medical emergencies, very important topic. So they will give you some medical emergency and you people have to mark the best medicine for that, right? So topic number 3 based on medical emergency. So the first medical emergency is based on ACLS algorithms. So we have a ACLS algorithms. We also call it advanced cardiac life support algorithm. So advanced cardiac life support algorithm. So here they can ask you the best medicine for heart block. So what is the drug of choice for heart block? You people have to give me the answer. What is the best medicine for cardiac arrest? So what is the best medicine for cardiac arrest? And what is the best medicine for PSVT? So there are three algorithms where we have the drugs. So what is the best medicine for heart block? Anyone can answer. This is very important for this year exam, bache. Which medicine is best medicine for heart block? Which medicine is best medicine for bradycardia? So very important for your exam this year, the medicines which are given for heart block and bradycardia. So heart block and bradycardia, the best medicine to be used is atropine. So atropine is best medicine for heart block, best medicine for bradycardia. This is very important for this exam. I'm telling you, instead of other two, concentrate on this heart block and bradycardia. Atropine is the drug of choice. Now, what is the best medicine for cardiac arrest? So cardiac arrest का best medicine है adrenaline. So adrenaline is the best medicine for cardiac arrest. Now for this cardiac arrest, how we use adrenaline? So adrenaline ka concentration that we use is 1:10,000. So 1:10,000 is the concentration. The dose of the medicine is 1 milligram, and this medicine is given by the route that is known as the intravenous route or by the intraosseous route. So medicine is given by intravenous route, intraosseous route. Medicine concentration 1:10,000 that is given for adrenaline. Now, cardiac arrest patient can come to you with ventricle fibrillation or ventricle tachycardia. So, what is the presentation of cardiac arrest? Presentation of cardiac arrest is ventricle arrhythmias. So, they are asking ventricle arrhythmias mein, when the patient has got a cardiac arrest, after giving adrenaline and doing the CPR. So, you will do the CPR and give the adrenaline to the patient. Then, after giving CPR and adrenaline, which medicine we can use? So cardiac arrest में ventricle fibrillation, ventricle tachycardia. Presentation है. Adrenaline is a drug of choice that we have already covered. But after adrenaline, which antiarrhythmic you will give? So who will tell me which antiarrhythmic is antiarrhythmic of choice for ventricular arrhythmia? So antiarrhythmic of choice is amiodarone. So amiodarone is an antiarrhythmic of choice that is given after adrenaline. In case it is not given, you will give lidocaine. So amiodarone and lidocaine are the two antiarrhythmics that we use for ventricle type of arrhythmias. So ventricle arrhythmias, we use amiodarone and lidocaine after giving adrenaline. So after giving adrenaline, we will use, yes, so we will do CPR. We will also give the shock to the patient. I'm just skipping some steps. I'm not writing each and everything here. So I'm skipping some steps over here which are not relevant for the exam. So first medicine is adrenaline. After that, we will give amiodarone and lidocaine. Now, which medicines we can use for PSVT? Now, for the treatment of PSVT, we can use the 5 medicines. That mnemonic is ABCDE, where the A stands for adenosine. So adenosine is a drug of choice for this condition, and adenosine is a drug that is always given by IV route. So this medicine is always given by IV route. This medicine has a very short half-life. So medicine has a very short half-life, always given by IV route. The first dose of medicine is 6 milligram. The second dose of medicine is 12 milligram. First dose 6 milligram, second dose 12 milligram. And this medicine should not be given in patients of bronchial asthma and COPD. So patients of bronchial asthma and COPD, adenosine, uh, doctor, actually, I'm writing here the content which is relevant for your pharmacology. Actually, I'm just skipping the steps which are relevant for other subjects. But in case you want to write, because you are asking again and again, so you will do shock. You will give shock first. After giving shock, you will do CPR. Okay. Now, is it fine for you? So first we give shock, then we do CPR, then we give adrenaline. Okay, fine. Now is it comfortable for you? First we'll give shock, then CPR, then adrenaline in patients of cardiac arrest. Done now. So adenosine is drug of choice given by intravenous route. Medicine has a shorter half-life. The first dose and second dose we have written. Contraindication of medicine is bronchial asthma and COPD. Now we have a second medicine, that is beta blockers. So beta blockers can also be given for this condition. Now we can have the third group of medicines. We call them calcium channel blockers. Now in calcium channel blockers, we prefer to use the drug like verapamil and diltiazem. So verapamil and diltiazem are the medicines that is a calcium channel blocker. Now, uh, now, no, bache, first you give shock, then CPR. Not first CPR, first shock, then CPR. First is shock, then you do then you give CPR. Okay, give it 2 times. So verapamil and diltiazem, 2 medicines we can use. Now these medicines given by oral route as well as by IV route. These medicines given by oral route as well as by IV route. Now here the verapamil is preferred. So verapamil is considered as second drug of choice. It is considered as second drug of choice for acute PSVT. It is a second drug of choice for acute PSVT. This is given by IV route. Now this is the drug of choice. This is the drug of choice for acute PSVT. This medicine becomes the drug of choice for acute PSVT if the patient is having a bronchial asthma and COPD. So this medicine becomes the drug of choice for acute PSVT if a patient has got bronchial asthma and COPD. Now, this is the drug of choice for maintenance treatment. It is the drug of choice for maintenance treatment of PSVT when given by oral route. So, oral route say verapamil is the best medicine to be given. So, verapamil is the best medicine to be given for maintenance treatment. Right? So, drug of choice for maintenance treatment of PSVT, this medicine is given by oral route. So, this is very important, बच्चे ये इस बार आपको आएगा. तो verapamil is given by oral route for maintenance treatment. आपको क्वेश्चन आएगा कि prophylaxis के लिए कौन सा ड्रग देते हैं. So which medicine is given for prophylaxis? So which medicine is given for prophylaxis of PSVT? So what is the drug that is given for prophylaxis of PSVT? So answer is we can give verapamil. So this is the question that is going to be asked for this year exam. Now we have a medicine D. D stands for digoxin. So next medicine that we can use for PSVT is digoxin. Now the fifth medicine that we can use here is etripamil. So etripamil is a medicine which is like a verapamil. So this is just like a verapamil calcium channel blocker, but this is a nasal spray. So this medicine is a nasal spray, can be given to a patient. So these medicines we can use for PSVT. So PSVT में we can use the 5 medicines. The mnemonic is A, B, C, D, E. Now these are important in medical emergencies. Now the second medical emergency they can ask you the treatment of shock. So which medicine is drug of choice for shock? So which medicine is the best medicine for shock? So the most commonly used medicine that we can use for shock is noradrenaline. So noradrenaline is the best medicine for the shock. The second medicine that we can use for the treatment of shock is dopamine. So noradrenaline is the best medicine, followed by the dopamine. Dopamine का जो dose है, that is always more than 10 microgram per kg per minute. So dopamine का dose is always more than 10 microgram per kg per minute. Right? This is for the treatment of shock. Right? So noradrenaline is the best medicine. Now there are some exceptions. So there are some exceptions where we use the other medicines. So what are those exceptions? The first exception is the anaphylactic shock. So you people have to give me the answer. What is the drug of choice for anaphylactic shock? What is the best medicine for anaphylactic shock? The second is cardiogenic shock. The second is cardiogenic shock. So anaphylactic shock, cardiogenic shock. यहाँ पर कौन सा drug use होगा? So norepinephrine is the best medicine for shock, but exceptions are anaphylactic shock and the cardiogenic shock. So which medicine we can use for this? Right? So anaphylactic shock में we can use which medicine? What is the drug of choice here? So drug of choice is adrenaline. So here we have a drug of choice adrenaline. Here we have a drug of choice dobutamine. So here we have a drug of choice dobutamine. So cardiogenic shock में we have dobutamine. So dobutamine acts on beta 1 receptor, and we have a drug adrenaline. This medicine acts on alpha 1 receptor, increase the blood pressure, and medicine will act on beta 2 receptor. And by acting on beta 2 receptor, this medicine can cause bronchodilation. So medicine can cause bronchodilation for anaphylactic shock. Now here you people have to answer me, what is the concentration of adrenaline that we use for anaphylactic shock? So anaphylactic shock mein, what is the concentration of adrenaline that we use? What is the dose of the medicine that we can use? And what is the route of administration? So what is the route of administration that we use? Yes, so one of the student has already answered. 1:1000 is the concentration, 0.5 milligram. 0.5 milligram is a dose. So 1:1000 is the concentration, 0.5 milligram is a dose, and the route is intramuscular route. So the route is intramuscular route that we can use for the patient of anaphylactic shock, right? And for cardiogenic shock, the best medicine is dobutamine. Otherwise, for all other shock, you people are supposed to remember the best medicine is noradrenaline. So if they have given you the treatment of septic shock, or they have given you the treatment of neurogenic shock or hypovolemic shock, so any shock they have given you. So hypovolemic shock, neurogenic shock, septic shock, the best medicine is noradrenaline, right? Otherwise, these are the two exceptions where we give the other medicines, okay? Now the third is, what is the best medicine for acute hypotension? So which medicine is the best medicine for acute hypotension? So any patient whose blood pressure is less than 90/60. So any patient who has come to you with acute hypotension, right? So which medicine we can use for this patient? So the drug of choice for this condition is noradrenaline. So noradrenaline is the best medicine for this condition. So this medicine, important side effect is tachycardia and arrhythmia. So medicine, important side effect is tachycardia and arrhythmia. So noradrenaline can cause tachycardia, arrhythmia as a side effect. So if a patient is already having the tachycardia, so in that case, you will mark the best medicine as a vasopressin. So in that case, the vasopressin hormone, which is V1 receptor agonist. So this hormone will act on V1 receptor. So that is the best medicine in case the patient is already having the tachycardia. Now, in case the vasopressin is not given to you, you can also mark one more medicine, phenylephrine. So phenylephrine, that will act on alpha 1 receptor. This will act on alpha 1 receptor. This will be the drug of choice, right? Now, in case noradrenaline is not able to control, the second medicine you will mark as the best medicine is a vasopressin. So vasopressin will be the second best medicine for acute hypotension. But in case there is a tachycardia, vasopressin will be the drug of choice, the third medical emergency that we people have covered. So these are the some important medical emergencies that we have covered in this topic. So topic number 3, sorry, which is relevant for your exam is medical emergency that we have covered over here. Now moving on to topic number 4. Which are important and relevant for your exam, that is the topic is alpha blockers. So the topic is alpha blockers. So alpha blockers mein they will ask you two things. So they will ask you two things in alpha blocker. They will ask you the treatment of BPH. So what are the drugs that we can use for BPH? So who will tell me which medicine is drug of choice for BPH? So what is the drug of choice for BPH? First topic they will ask you. Second topic they will ask you the pheochromocytoma. So condition is known as pheochromocytoma. So BPH ka treatment, who will tell me which medicine is the best medicine? So which medicine is the best medicine for BPH treatment? Anyone would like to answer? Yes, the answer is tamsulosin. So tamsulosin, which is an selective alpha 1A blocker. So this medicine is selective alpha 1A blocker. This is the best medicine for BPH, and the important side effect of this medicine you can remember with the mnemonic fire. So this medicine can cause important side effect as fire. Now the first side effect that starts with FI is a floppy iris syndrome. So this medicine can cause floppy iris syndrome as an important side effect, where the patient will develop meiosis during the eye surgery that will cause complication. Now this medicine can also result in retrograde ejaculation. So can result in retrograde ejaculation, can result in floppy iris syndrome. So tamsulosin is the best medicine. So tamsulosin is the best medicine for the treatment of BPH. Now who will tell me if the tamsulosin is not able to control the disease? If tamsulosin is not able to control the disease, which medicines will be the second drug of choice? The second drug of choice will be the medicines, we call them 5-alpha reductase enzyme inhibitors. So medicines are known as 5-alpha reductase enzyme inhibitor. Now these medicines will inhibit the conversion of testosterone to dihydrotestosterone. So medicines inhibit the conversion of testosterone to dihydrotestosterone. So these medicines will be the second drug of choice for uh, BPH after tamsulosin. So who will tell me the drug names? Yes, the medicines names are finasteride, and we can have the other drug like dutasteride. So we have medicines like finasteride, dutasteride. So these medicines will be the second drug of choice. Now these medicines will be the second, and the tamsulosin is first. Now in treatment of pheochromocytoma, they can ask you which medicines are the best medicine that we use pre-operatively. So before the surgery, which medicine are the best medicine for hypertension treatment? So which medicines are the best medicines for hypertension treatment before surgery? तो बताओ सर्जरी से पहले, if you want to control the hypertension in pheochromocytoma, what is the best medicine that we can give? So here the drug of choice is phenoxybenzamine. Here the drug of choice is phenoxybenzamine. So phenoxybenzamine is the best medicine to be given. Now phenoxybenzamine is a non-selective alpha blocker. So this is alpha 1, alpha 2 blocker, non-selective alpha blocker. Now this is an irreversible alpha blocker. So this medicine is an irreversible alpha blocker. So this medicine is the best medicine that is given pre-operatively to control the BP before surgery. Now in case phenoxybenzamine is not given, you can also mark the other medicines like the metyrosine. So we have a drug which we can also use. The drug name is metyrosine. We can also use the medicine nicardipine. So nicardipine can also be given before surgery. So we have other drugs like metyrosine, nicardipine can be given before surgery. Now second question they can ask you. Now which medicine we can use intraoperatively? So during the surgery of pheochromocytoma. So during the surgery of pheochromocytoma, which medicines we can use? So during the surgery, if a patient has got hypertension crisis, तो सर्जरी में अगर क्राइसिस हो रहा है तो वहां पर कौन सा ड्रग होगा? सो हियर वी गिव ऑल मेडिसिन बाय IV route. So the best medicine is nitroprusside. So here we have a medicine, the drug name is nitroprusside. So nitroprusside is a medicine of choice that is given to this patient, but the important side effect of this medicine is cyanide toxicity. So cyanide toxicity is an important side effect of nitroprusside. So here we give an antidote. The antidote of cyanide toxicity is vitamin B12. We also call it hydroxycobalamin. So hydroxycobalamin is vitamin B12. So this is the best antidote of choice for cyanide toxicity. So nitroprusside is the best medicine. But in case nitroprusside is not given, we can also use the medicine phentolamine, and we can also use the medicine like nicardipine. So nicardipine and phentolamine are the medicines that we can also use. So you can see if nicardipine is a drug that we can use both pre-operatively as well as intraoperatively by IV route. Okay? So nicardipine is given always by IV route. So we can use it pre-operatively. We can also use intraoperatively for the treatment of pheochromocytoma. But the overall best medicine pre-operatively is phenoxybenzamine, and intraoperatively it is nitroprusside. Okay, guys. So this is the topic number 4, which is important for your exam. That is alpha blocker. Now after alpha blocker, the topic number 5, which is important for your exam, is anti-glaucoma drugs. So the topic is anti-glaucoma drug. Now I think this topic has already been covered. So this topic has already been covered in ophtha. So there are many topics in pharma which are overlapping with other subjects. So this has already been covered in ophtha and are the high yield topics. So again, I would emphasize on this point, this topic is important for your exam. Just for the sake of your revision, can you please tell me which medicines we can use? What is the treatment of choice for acute angle closure glaucoma. What is the treatment of choice for acute angle closure glaucoma? And what is the drug of choice for maintenance treatment of glaucoma? So can you please tell me what is the best treatment for acute angle closure glaucoma and which medicine is the best medicine for maintenance treatment of glaucoma? So acute angle closure glaucoma, the first medicine we always give is acetazolamide. So acetazolamide is not an eye drop. This is given by IV route or the intra or the oral route. Yes, so acetazolamide is the best medicine that is used. Now acetazolamide is always given with an eye drop. It is always given with an eye drop. We call it a pilocarpine eye drop. So acetazolamide plus pilocarpine combination is the best treatment for acute angle closure glaucoma. So acute angle closure glaucoma, the best medicine is acetazolamide plus pilocarpine. ये acute case है. But in case MCQ में they have not given anything. आपको कुछ नहीं given है. They just ask you कि glaucoma का best medicine क्या है? What is the overall best medicine for glaucoma? So what is the best medicine for glaucoma? What is the best medicine for maintenance treatment? Then you will mark the latanoprost. So if they have not mentioned कि patient is having acute glaucoma or which glaucoma, nothing is mentioned. Then answer latanoprost. So latanoprost, which is a prostaglandin analog. So this medicine is the best medicine for maintenance treatment. Now, in case the condition is not controlled by latanoprost, you will add the beta blocker. You will add the beta blocker timolol. So timolol is a beta blocker. That is a second drug of choice. So latanoprost is the drug of choice. Timolol is a second drug of choice for maintenance treatment. But please remember, guys, timolol is not given to a patient of bronchial asthma and COPD. So timolol ko we don't use in a patient of bronchial asthma and COPD because this medicine can cause bronchospasm as an important side effect. Yes, so one of the student has already answered. Latanoprost is a medicine. Its mechanism of action. This medicine can increase the uveoscleral outflow. Very good answer, bache. So it will increase the uveoscleral outflow. The drug name is latanoprost. It's the best medicine for maintenance treatment. Right? So one of students has asked कि sir mannitol को कहाँ use करेंगे? तो mannitol को we use in refractory cases. So acute glaucoma में अगर condition is not controlled by the above regimen, then we will give mannitol by IV route. So mannitol is given by IV route in refractory cases of acute glaucoma. So most of the time they don't ask question on mannitol. So mannitol is given in refractory cases of acute glaucoma, right? Mostly they ask the first medicine. So acetazolamide is the best answer for acute glaucoma and latanoprost is the best medicine for maintenance treatment. Okay, bache. So this topic you will cover from your subject ophtha. So ophtha mein this topic is already covered. So I'm not going into the much detail, right? So moving on to the topic number 6, which is relevant for your exam. So topic number 6, which are relevant for your exam, that is from the respiratory system, drugs for bronchial asthma. So what are the drugs that we can use for bronchial asthma? So the medicines that we can use for bronchial asthma, we can divide them in two categories. So medicines of bronchial asthma, we can divide them in two categories, right? So we have the medicines like controllers. We have the medicines, we call them relievers. So we have two types of medicines. One we call them controllers, other we call them relievers. Now, which medicines are controllers? So answer is inhalational corticosteroids. So inhalational corticosteroids, we call them ICS, inhalational corticosteroids. Now these medicines are the drug of choice. They are the best medicines for bronchial asthma. These medicines are the best medicines for bronchial asthma. We call them inhalational corticosteroids, where the most commonly used medicine is budesonide. So budesonide is the most commonly used medicine. It's the best medicine for bronchial asthma. This will come under this group of controllers. Now, the second medicine, which is controller, is known as montelukast. So we have a second medicine. The drug name is montelukast. We have a medicine like zefirlukast. So we have medicines like montelukast, zefirlukast. Now these medicines are the leukotriene receptor inhibitors. These are the drugs which are leukotriene receptor inhibitors. We call them leukotriene receptor inhibitors. Now these medicines are given by oral route. Now these medicines have slow onset of action. So medicines have slow onset of action given by oral route. They cannot be given for acute attack of bronchial asthma. So these medicines cannot be given for acute attack of bronchial asthma. Medicines have the slow onset of action. Now third medicine which is controller is IgE inhibitor. So medicine which is IgE inhibitor, drug name is omalizumab. Somalizumab is a medicine which is Ig inhibitor, is the third medicine which is known as controllers. Now, out of these medicines, the most important for your exam is the steroids. Now, they will ask you what are the side effects of steroids. So, can you please tell me whenever we give inhalational corticosteroids, to a patient, what is the most common side effect of medicine and how we control that side effect? What is the most common side effect of inhalational corticosteroids? Anyone can answer. So the answer is the most, yes, the medicine is most common side effect of inhalational corticosteroid. Medicine name is oral candidiasis. So oral candidiasis, oral thrush is the most common side effect of medicine. So most common side effect of medicine, oral candidiasis, oral thrush is the most common side effect of inhalational corticosteroids. Now, who will tell me? Yes, we can prevent. So we can prevent this side effect by using a spacer. That's fine. So we can use a spacer to prevent this side effect. Now, you people have to answer me, what is the treatment? Prevention is by spacer. What is the treatment? Yes, the drug of choice for treatment is fluconazole. So fluconazole is given by oral route. This is the best medicine for the treatment of oral candidiasis. That's the best medicine. But who will tell me what is the name of a local medicine that we can use? So local may we can use a drug clotrimazole. So local may we can use a medicine clotrimazole. So local drug is clotrimazole, but the overall best medicine is fluconazole that is taken by oral route. So that's a drug of choice for oral candidiasis. Now, if we talk about the relievers, now which medicines are relievers? So these medicines are known as the bronchodilators. So these medicines are known as the bronchodilators. Now, which medicines are the bronchodilators? So we have the medicines which are known as beta 2 agonists. So medicines को बोलते हैं beta 2 agonist medicines. So beta 2 agonist medicines are the bronchodilators. So here we have a drugs like SABA, short acting medicines, and here we have a medicines like LABA, long acting medicines. So we have a short acting medicine, we have a long acting medicine. So short acting medicine is a salbutamol. Salbutamol is a shorter acting medicine. The longer acting medicine, we have an example like the formoterol. We have an example like salmeterol. So formoterol, salmeterol are examples of LABA, and SABA is a salbutamol. Okay, now you people have to tell me the important side effects of salbutamol. So side effects of salbutamol are very important that you can remember with the mnemonic 3T3H. So this is very important for your exam, salbutamol side effect that we can remember with the mnemonic 3T3H. So three side effects start with T, three side effects start with H, right? So medicines ka most common side effect is tremors. So medicine can cause tremors. Medicine can result in tachycardia. And when we use salbutamol, patient will develop tolerance to the action of salbutamol. So tremors, tachycardia, tolerance, this medicine can result in hyperglycemia. Now this is very, very important for your exam. So this medicine can cause hyperglycemia. Medicine can cause hypokalemia. So this medicine can cause hypokalemia, can result in hypotension because of the vasodilation. So this medicine can cause vasodilation, can result in hypotension as a side effect. Total 6 side effects this medicine can cause. 3 side effects start with T, 3 side effects start with H. Medicine can cause tremors, tachycardia, tolerance. Medicine can cause hyperglycemia, hypokalemia, can result in hypotension as a side effect. The drug name is salbutamol, beta 2 agonist. Now after beta 2 agonist, we have the medicines which are the muscarinic 3 receptor blocker. So we have an anticholinergic medicine. So here we again have the medicines like the SAMA and LAMA. So medicines are SAMA and LAMA, short acting and the long acting muscarinic antagonist. So short acting, long acting muscarinic antagonist. So short acting muscarinic antagonist, the drug name is ipratropium. So we have a drug, we call it ipratropium, and the long acting medicine is tiotropium. So long acting medicine, tiotropium, short acting medicine, ipratropium. And when we use this medicine, the important side effect of medicine is dry mouth. So these are the anticholinergic drugs. They will cause dry mouth as a side effect. So these medicines can result in dry mouth as a side effect. Now third bronchodilator is magnesium sulfate, that is always be given by IV route. So magnesium sulfate always be given by IV route. And the fourth medicine which is a bronchodilator, drug name is theophylline. So theophylline is a medicine that we obtain from tea and coffee. Theophylline is a medicine that we obtain from tea and coffee, and we people have discussed in lecture also. T for theophylline, E for enzyme inhibitor. So this medicine is an enzyme inhibitor. Particularly, this medicine is a phosphodiesterase enzyme inhibitor. So this medicine is phosphodiesterase enzyme inhibitor, and this medicine is also adenosine receptor blocker. So this is the drug which is adenosine A1 receptor blocker. So this medicine is an enzyme inhibitor. This medicine is also an adenosine A1 receptor blocker. Medicine का origin is from T. So theophylline का mnemonic है T. T for theophylline, E for enzyme inhibitor, A for adenosine A1 receptor blocker. So theophylline is used as a bronchodilator. Now all side effects of medicines are mainly due to adenosine blocking effect. So if they will ask you कि theophylline में कोई भी side effect हो रहा है, that is due to which reason? Answer is adenosine blocking effect is the main reason. So adenosine blocking effect is the main reason for all side effects of this medicine. So whatever side effects given to in the exam that is caused by theophylline is due to the adenosine blocking effect. So these are the medicines that we can use for bronchial asthma. And what is the treatment of choice for bronchial asthma? Treatment of choice for bronchial asthma is we give a combination of inhalational corticosteroids with a LABA. So inhalational corticosteroids में we prefer to use budesonide. और LABA में we prefer to use a medicine formoterol. So budesonide plus formoterol combination is the best treatment for bronchial asthma, जिसमें से steroids जो है वो drug of choice है. Steroids are the best medicines, but we don't give them alone. We always give them with long-acting medicine, that is formoterol. So this combination is the best treatment for bronchial asthma. So this topic is important. Topic number 6, bronchial asthma, we people have covered. Now topic number 7, which are relevant for your exam and where the questions can be asked, that is on the diuretics. So medicines को बोलते हैं diuretics that will act on PCT of kidney. So what are the diuretics that will act on PCT of kidney? Right? So which diuretics can act on proximal convoluted tubule? What are the group of diuretics that will act on proximal convoluted tubule of kidney? So answer is medicines को बोलते हैं carbonic anhydrase enzyme inhibitors. So medicines are carbonic anhydrase enzyme inhibitors. Medicines are SGLT2 inhibitors, and we have a medicine like mannitol. So 3 group of medicines that will act on PCT of kidney: carbonic anhydrase inhibitor, SGLT2 inhibitors, and the mannitol. Now here in carbonic anhydrase inhibitors, we have a medicine acetazolamide. So acetazolamide is a medicine that belongs to this class. Now this medicine is a first drug. It is a first medicine to be given in patients of acute angle closure glaucoma. This we have already covered. Now this is the best medicine for mountain sickness. This is the best medicine for mountain sickness, right? It is also given for glaucoma, and it is a second drug of choice. Second drug of choice for raised ICT. Second drug of choice for raised ICT. Drug name is acetazolamide. Now we have some eye drops here also. We have some eye drops. So which eye drops we can use? Medicines names are brinzolamide and dorzolamide. So eye drops are brinzolamide and the dorzolamide. Now these medicines are always be given for glaucoma. So these are the medicines that we use for glaucoma. Drugs names are brinzolamide and dorzolamide. Right? So what is the important side effect of this class? So important side effect of this class is metabolic acidosis. So these medicines can result in important side effect as metabolic acidosis and the renal stones. Now the medicines which are SGLT2 inhibitors. So medicines which are SGLT2 inhibitor, all these medicines end with the word gliflozin. इनके लास्ट में आता है gliflozin. Yes. So Dr. Arshad has already given the answer. Medicine के name है like dapagliflozin. Any other name guys you know? So one more drug is empagliflozin. So we have the medicines like dapagliflozin, empagliflozin. These medicines are SGLT2 inhibitors. Now where do we use this medicine? Now these medicines are given for the treatment of congestive heart failure. So these medicines are given for congestive heart failure. Now these medicines can reduce the mortality. So when we use these medicines in patients of heart failure, they can reduce mortality. This is very important for your exam. CHF में these medicines can reduce mortality. Now these medicines are also being given for diabetes mellitus 2. And diabetes mellitus 2 में these medicines can reduce the risk of coronary artery disease. So these medicines can reduce the risk of coronary artery disease. They can also reduce the risk of nephropathy. So diabetes में they can reduce the risk of heart disease like heart attack. They can also reduce the risk of nephropathy. मेडिसिन के नेम्स हैं डेपाग्लिफ्लोजिन, एम्पाग्लिफ्लोजिन. ठीक है, you people are writing kenagliflozin, but kenagliflozin is getting outdated, so these are more relevant for your exam. डेपाग्लिफ्लोजिन, एम्पाग्लिफ्लोजिन. ठीक है, अब इनके साइड इफेक्ट्स क्या हैं? यू मस्ट बी नोइंग द इंपॉर्टेंट साइड इफेक्ट्स ऑफ मेडिसिन इज यूटीआई. So these medicines can result in increased risk of UTI. So urinary tract infection can occur, vulvovaginitis. So these medicines can cause genital infection like the vulvovaginitis. Medicines can result in Fournier's gangrene. So can result in Fournier's gangrene, vulvovaginitis, UTI can occur. These are the important side effects of this medicine. These medicines can also result in weight loss. And guys, please remember, these medicines can increase the risk of diabetic ketoacidosis. These medicines can increase the risk of diabetic ketoacidosis, although these medicines are anti-diabetic. है तो ये anti-diabetic, but they increase the risk of diabetic ketoacidosis as a side effect. ठीक है. Now this is important because they have already asked you the UTI, but they have not asked in your exam so far कि these medicines can result in which type of diabetic ketoacidosis. Particularly, these medicines will cause euglycemic. So euglycemic diabetic ketoacidosis, important side effect of SGLT2 inhibitors. Now, if we talk about this drug, mannitol. Mannitol is always given by IV route. Mannitol is a drug that is always given by IV route. Now, this medicine is a drug of choice for cerebral edema. This is the drug of choice for cerebral edema. This medicine is drug of choice for raised ICT. So this is the best medicine for raised ICT, also given for cerebral edema. Also, this medicine is given for acute angle closure glaucoma. The drug name is mannitol, and this mannitol should not be given. Mannitol should not be given in patients of congestive heart failure associated with pulmonary edema. So patients of congestive heart failure with pulmonary edema, this is contraindicated. So congestive heart failure with pulmonary edema, this is contraindicated. This is also contraindicated in the last stage of kidney disease. So end stage renal disease. So end stage renal disease, last stage of renal disease, this is contraindicated. This is contraindicated in patients of end stage renal disease and also contraindicated in congestive heart failure and pulmonary edema. So this is the medicine that is contraindicated. So this topic number 7, the medicines that will act on PCT of kidney. This is very important for your exam. Now moving on to topic number 8. So topic number 8, which is important and relevant for your exam, that is aldosterone receptor antagonist. So medicines ko we call aldosterone receptor antagonist. So medicines are aldosterone receptor antagonist. We also call them potassium sparing diuretics. We also call them potassium sparing diuretics. We call them aldosterone receptor antagonists. So topic number 8, which is important for your exam. So we have total 3 medicines belong to this class. One of them is known as spironolactone. One of them is known as eplerenone. So one drug is spironolactone, other drug is eplerenone, one more drug is finerenone. So 3 medicines belong to this class: spironolactone, eplerenone, and finerenone. Now please remember, spironolactone is steroidal, eplerenone is also steroidal, but finerenone is a medicine which is non-steroidal. So it's a new medicine which is non-steroidal in structure. Now spironolactone is a medicine which has a non-specific action. This has a non-specific action on heart and kidney. So this has a non-specific action on heart and kidney. But eplerenone is a drug which has more action on heart than kidney. Finerenone is a drug which has more action on kidney than on heart. Right? So finerenone is more for the kidney. Now spironolactone is a medicine that is approved for congestive heart failure. This medicine is also given for the treatment of resistant hypertension. We use it for CHF. We use it for resistant hypertension. We can also use this medicine for ascites. And for the treatment of ascites, this is drug of choice. For resistant hypertension, it's a drug of choice. It's a best medicine for resistant hypertension, best medicine for ascites. Now, same indication here. This is given for CHF. This is also given for resistant hypertension. Right? Now, this has also been approved for ascites. But if we talk about this medicine, finerenone is also given for CHF, but this is not an antihypertensive, and this medicine has got an approval for the treatment of diabetic nephropathy. So we can use this medicine for the treatment of diabetic nephropathy. So this can reverse proteinuria. This can reverse proteinuria. This is not used for hypertension, not given for hypertension, not given for ascites. The drug name is Finrenol. The Finrenol is not given for this condition. Now, this medicine, important side effect is gynecomastia. So this medicine, important side effect is gynecomastia, but this side effect is absent with other drugs. So gynecomastia is an important side effect that is seen with this medicine. Now, this is the drug that will cause maximum risk of hyperkalemia. This will cause maximum risk of hyperkalemia. This has a moderate risk of hyperkalemia, and this has a minimum risk of hyperkalemia. So Finrenol is a medicine which has a minimum risk of hyperkalemia, right? So these are the some important relevant points that you should be knowing. One more point is this medicine is longest acting drug. So this medicine is longest acting, right? And other medicines are comparatively the shorter action. Other medicines are comparatively the shorter acting medicine. Now this is important for your exam. The topic number 8 I have covered. Medicines को बोलते हैं potassium sparing diuretics, that can be asked in the exam. Specifically these days people are using these medicine. Finrenol is very commonly used in day-to-day practice. So this may be asked in the exam. Now moving on to topic number 9. So topic number 9 that is relevant for your exam, that is based on antidiuretic hormone. So medicines that will act on antidiuretic hormones. So which medicines will act on antidiuretic hormone pathway? That is topic number 9. So topic number 9 mein, there are few medicines which are known as agonist. There is one medicine that is known as antagonist. So ADH drugs mein we have agonist, we have antagonist. So agonist mein we have a drug that will act on V1 receptor. We have a medicine that will act on V2 receptor. So medicine that will act on V1 receptor, drug name is terlipressin. Drug name is terlipressin. Medicine that will act on V2 receptor, drug name is desmopressin. Drug name is desmopressin. And the antagonist is a medicine which is vasopressin 2 receptor antagonist. So vasopressin 2 receptor antagonist, the drug name is tolvaptan. The drug name is tolvaptan. Now terlipressin given to Tully people, you must be knowing. Terlipressin, Tully se start hota hai, Tully people. This is our best medicine for alcoholic patient. Best medicine for alcoholic patients suffering from acute bleeding esophageal varices. So any patient of acute bleeding esophageal varices, that's an alcoholic patient, right? So terlipressin is the best medicine. Now desmopressin is the best medicine for central diabetes insipidus. It's the best medicine for central diabetes insipidus. This is the best medicine for nocturnal enuresis. So nocturnal enuresis, central diabetes insipidus, desmopressin is the best medicine. Now tolvaptan is the best medicine for SIADH. It is the best medicine for SIADH. The drug name is tolvaptan. So this topic number 9, based on ADH drugs. So whatever topic I'm discussing here, I'm discussing very superficially. You people are supposed to read this topic in detail for your exam, right? That is a topic number 9. Now moving on to topic number 10. So we talk about this topic number 10, which is important for your exam. That's an anti-hypertensive drugs. So topic number 10 is anti-hypertensive drugs, which can be asked in your exams. So anti-hypertensive drugs mein we have a diuretics. So diuretics can be used for hypertension. Autonomic system drugs can be used for hypertension. RAS system blockers can be used for hypertension. And we have a topic like vasodilators. So vasodilators can be given for hypertension. So these medicines you people are supposed to read in detail. So you people can tell me diuretics mein which diuretics are the first line drugs for hypertension? So what are the diuretics which are the first line drugs for hypertension? You people have to answer me. Now in RAS inhibitors, the medicines which are important for your exam are AC inhibitors and the ARB. And in vasodilators, medicines which are important for your exam are the calcium channel blockers. So no, first line drugs for hypertension are known as the thiazides. So thiazides are the first line medicines for hypertension. These medicines will act on early part of DCT. Medicines will act on early part of DCT. The medicine that we prefer in day-to-day practice is chlorthalidone. So chlorthalidone, indapamide are the thiazides which are preferred for hypertension, given for the maintenance treatment of hypertension as a first line drugs, right? So thiazides are given as a first line drugs for hypertension. Now, whenever we give thiazides, the basic problem with thiazides is they can lead to metabolic side effects. So these medicines can result in metabolic side effect, like they will result in hyperglycemia, can result in hyperlipidemia, can result in hyperuricemia. So can result in hyperuricemia, hyperlipidemia, hyperglycemia as a important metabolic side effects. Now, if we talk about ACE inhibitors, all ACE inhibitor end with the word pril and all ARB end with the word sartan. So all ACE inhibitors end with the word pril, all ARBs end with the word sartan. So these medicines are also used as a first line drugs. So these medicines are also used as a first line drugs for maintenance treatment of hypertension. Now here you people have to give me the answer. If I ask you this question, all ACE inhibitor ARBs, all ACE inhibitor ARBs are prodrugs except which two? So all medicines are prodrugs except which two medicines? So which two medicines are not prodrugs? So all medicines are prodrugs except which two? So all ACE inhibitors ARBs are prodrugs except which two medicine? Plus you people have to answer me one question. What is the drug? Yes. So the two exceptions are captopril and the lisinopril. So captopril, lisinopril are the medicines which are not prodrugs. Now, can you please tell me the special properties of losartan? So, what are the two special properties of losartan other than hypertension? Losartan ke there are two more properties other than hypertension. So, who will tell me what are the two properties of losartan? What is the property of telmisartan? What is the property of telmisartan? And where else we use this medicine, candesartan? So losartan is a drug which has two property that we can remember with a mnemonic POGO. POGO is a mnemonic. So this medicine has anti-platelet property. Medicine has anti-platelet property and medicine also has anti-gout property. So this medicine has anti-platelet and anti-gout property, right? Telmisartan is a drug which is having the anti-diabetic property. So telmisartan has anti-diabetic property. Losartan has anti-platelet, anti-gout property. Telmisartan has anti-diabetic property, and this medicine is safe to use in kidney disease. So this is safe to use in kidney disease. This is metabolized by the liver. Now, candesartan is a drug that is given for the treatment of migraine. So that is given for the treatment of migraine. The drug name is candesartan. And if we talk about the medicine side effects and contraindication, for medicine side effects and contraindication, we can remember this mnemonic that we have already covered in the exam or covered in the class, captopril. तो medicines के side effects and contraindications में the mnemonic is captopril. ठीक है, इस captopril में बच्चे please remember one thing which I think can be asked in your exam. The thing is कि ये medicines pregnancy में contraindicated है. So these medicines are contraindicated in pregnancy where the P stands for pregnancy, right? One more is these medicines can increase the level of serum creatinine. So these medicines can increase the level of serum creatinine. So medicines आप avoid करते हैं. So we avoid the medicine if the serum creatinine is more than 2.5. So we can avoid the medicine if the creatinine level is more than 2.5. One more side effect of medicine is hyperkalemia. So these medicines can increase the level of potassium. Medicines can increase the level of potassium and you will avoid this medicine if the potassium level is more than 6.5. So this mnemonic is important for your exam. You should be knowing about the full form of this mnemonic. Like medicines can cause cough, angioedema, increased potassium, taste change, orthostatic hypotension. Pregnancy may they are contraindicated. I for increased creatinine. All these are important side effects. Now we have a third group of medicine, calcium channel blocker. So calcium channel blocker are also the first line drugs. They are also the first line medicines for hypertension. So calcium channel blockers which end with the word dipin. So the medicines which end with the word dipin, these medicines are the first line medicines for hypertension. Now can you please tell me, uh, one thing about calcium channel blocker? Which calcium channel blocker is drug of choice for subarachnoid hemorrhage? Subarachnoid hemorrhage में which calcium channel blocker is used? Which calcium channel blocker is used for subarachnoid hemorrhage? What is the name of a calcium channel blocker that is given for subarachnoid hemorrhage? Subarachnoid hemorrhage में which medicine is used? So the medicine name is nimodipine. So nimodipine is a medicine of choice for subarachnoid hemorrhage. Now, who will tell me one of the important side effect of this medicine is reflex tachycardia. So calcium channel blocker can lead to one important side effect as reflex tachycardia. But reflex tachycardia not seen with two medicines. There are two medicines that will not cause reflex tachycardia. One is amlodipine, one is cilnidipine. So cilnidipine and amlodipine are the two medicines that will not cause reflex tachycardia. So amlodipine, cilnidipine will not cause reflex tachycardia. All medicines can cause reflex tachycardia as a side effect. So this topic you people are supposed to read in detail. Medicines को बोलते हैं. Topic is antihypertensive drugs. Now we have a topic number 11 that is important for your exam. So we have a hypertension treatment guidelines. So hypertension treatment guidelines you people have to read in detail. So treatment guidelines for hypertension important for your exam, right? So इस topic में if I ask you this question, in young patients less than 55 years of age, which medicines are preferred? Answer is we prefer to use ACE inhibitor ARB. In old patients more than 55 years of age, we prefer to use calcium channel blocker or we prefer to give diuretics. So diuretics can be given, thiazides can be given, calcium channel blocker can be given, and less than 55 years of age we give ACE inhibitor ARBs, right? Now for resistant hypertension, which medicines are given? So the drug of choice for resistant hypertension is spironolactone. So that part we have already covered. Spironolactone is the best medicine to be given for resistant cases of hypertension. Yes. Now, what is a drug of choice for pregnancy-induced hypertension? So pregnancy-induced hypertension में labetalol. Labetalol is a drug of choice, but labetalol should not be given to pregnant female who has bronchial asthma and COPD. So females who have bronchial asthma and COPD, we prefer to use medicine nifedipine. So nifedipine will be the best medicine for PIH in case the female is having bronchial asthma and COPD. That is for the PIH. Now in PIH patients, please remember बच्चे, ACE inhibitors, ARBs are contraindicated. ACE inhibitor, ARBs, diuretics are the medicines which are contraindicated. Now which medicine is the best medicine for hypertension crisis? So hypertension crisis में best medicine is nicardipine. So best medicine for hypertension crisis is nicardipine, but nicardipine is not given alone. It is given with labetalol. So hypertension crisis, nicardipine is the best medicine. It is always given with labetalol. So these are the treatment guidelines for hypertension that you should be knowing in detail, because I am discussing superficially here. So you should be knowing all these things in detail because of lack of time. So I'm discussing these things very superficially. Now moving on to topic number 12. So topic number 12 that can be asked in your exam. This can be the congestive heart failure. So medicines that we use for congestive heart failure. So what are the drugs that we can use for congestive heart failure? So we can use the medicines that will decrease congestion. So medicines that will reduce congestion, right, in congestive heart failure. So here the best medicine is furosemide. So furosemide is a loop diuretic. This is the best medicine. The other medicines can be the SGLT2 inhibitors. So other medicines can be the SGLT2 inhibitors. Third group can be the aldosterone receptor antagonist. So these medicines are the diuretics. They keep the congestion under control. Number 2, which medicines can reduce mortality? So medicines that will decrease mortality, improve survival. Decrease mortality, improve survival in CHF. So which medicine can decrease mortality, improve survival? Medicine is ARNI. So ARNI is the best medicine, which is a combination of valsartan plus sacubitril. So this is the combination of valsartan plus sacubitril. So that is an ARNI. It's the best medicine in this class. We can also use other medicines like AC inhibitors. We can also use ARB. We can also use ARA, aldosterone receptor antagonist, like we have already covered. We can also use beta blockers. So beta blockers can be given for this purpose. Medicines can be metoprolol, bisoprolol, or medicine can be carvedilol. So three medicines are there. Out of them, carvedilol is most preferred. So three beta blockers given for this purpose. We have the medicines like SGLT2 inhibitors. So SGLT2 inhibitors can also reduce mortality. Now we have a combination of a drug, that is isosorbide dinitrite plus hydralazine combination. So this combination can also reduce mortality. So these are the 7 medicines total which can reduce mortality. The best is ARNI. Other medicines are AC inhibitors, ARBs, ARA, beta blockers. We have SGLT2 inhibitors. We have isosorbide dinitrite and hydralazine combination. Number 3, we have a medicines that will keep the heart rate under control. So the medicine that will keep heart rate under control is beta blockers. So beta blockers are the medicines that will keep heart rate under control. Again, 3 medicines are used. Carvedilol is best. We can also use metoprolol and bisoprolol for the same purpose. So this is the topic number 12, important for your exam, right? Congestive heart failure. Now after that, we have a topic number 13. So topic number 13 is from hematology, that is an blood thinners. So which medicine can inhibit the clotting system? So which medicines can inhibit the clotting system? We call them blood thinners, which will not allow the blood to clot. So we have total 3 group of medicines. We have antiplatelets. So we have medicines antiplatelets. We have medicines, we call them anticoagulants, and we have medicines, we call them thrombolytics. We also call them fibrinolytics. Thrombolytics and fibrinolytic medications. Now, which medicines are antiplatelet? So here we have an example like aspirin. Yes. Now, who will tell me the mechanism of action of aspirin? What is the mechanism of action of aspirin? Now, aspirin is a drug which is an irreversible inhibitor. So this medicine is irreversible inhibitor of COX-1 enzyme. It is an irreversible inhibitor of COX-1 enzyme. Stop the thromboxane A2 synthesis. Stop the thromboxane A2 synthesis. The drug name is aspirin, and this is the first drug to be given in patients of acute ST elevated MI. So this is the first medicine to be given in acute ST elevated MI. The drug name is aspirin. Now we have other medicines. So we have other medicines like we have a drug clopidogrel. Now who will tell me the mechanism of action of clopidogrel? So we have a medicine like clopidogrel. What is the mechanism of action? Now this medicine is inhibitor of P2Y12 receptor. This is the drug which is P2Y12 receptor inhibitor. Now this is also known as ADP receptor inhibitor. This is known as ADP receptor inhibitor, P2Y12 receptor inhibitor. Now this medicine is also an irreversible inhibitor. Just like in aspirin, this is also an irreversible inhibitor of this receptor. The drug name is clopidogrel. It's a P2Y12 receptor inhibitor. Now, where do we use antiplatelets? Antiplatelets ko we use during the arterial thrombi. So these medicines are used to prevent. So they will not dissolve the clot. They prevent the arterial thrombi. So these medicines we can use for MI patient. We can use these medicines for angina patients. We can also use this medicine for stroke patients. So patients of stroke, angina or MI, we can use these medicines. We call them antiplatelet medicines. They are given to prevent the arterial thrombi. Now we have anticoagulants. Now anticoagulants are the medicines. They can be of two types. Medicines can be directly acting. Medicines can be indirectly acting. So we have a directly acting medicine. So directly acting we have two types. Medicines which are factor 10A inhibitors. Now all the medicines which are factor 10A inhibitors, they end with the word XA ban. So factor 10A inhibitors, all medicines end with the word XA ban. So we have an example of a drug like rivaroxaban. So one example is rivaroxaban. One more example is like apixaban. So all these medicines end with the word xaban, and these medicines are given by oral route. We give these medicines by oral route. Now we have a factor 2 inhibitors. So medicines which are factor 2 inhibitors. Now here we have a drug that is given by oral route. The drug name is dabigatran. So we have a drug dabigatran. So dabigatran is a medicine that is given by oral route, that is factor 2 inhibitor. So factor 2 inhibitor given by oral route is dabigatran, and here we have a medicine ergotroban. Ergotroban given by intravenous route, factor 2A inhibitors. So these medicines are known as directly acting medicines. Now we have some medicines which are known as indirectly acting. We have some medicines which are known as indirectly acting medicines. Now indirectly acting medicines can be of two types. There are again two types. One is given by parenteral route. Medicines given by parenteral route. So medicine given by parenteral route is heparin. So heparin is a drug that is given by parenteral route, and during the toxicity of heparin. So heparin ka monitoring is done by APTT. So heparin monitoring is done by this partial thromboplastin time, and the antidote of choice for heparin is protamine sulfate. So protamine sulfate is an antidote of choice for heparin toxicity. Heparin toxicity, the antidote of choice, protamine sulfate, it is given by parenteral route. Now, which medicine we can give by oral route? Indirectly acting medicine that is given by oral route, the drug name is warfarin. So we have a drug warfarin. Okay. How will you recognize heparin? All medicine end with the word parin. सबके लास्ट में पेरिन आता है. All heparin ends with the word parin, like enoxaparin and all. So those medicines are like enoxaparin and all. Now warfarin is a drug that is given by oral route. Warfarin is a medicine that is given by oral route. This medicine can inhibit the clotting factor number 2, 7, 9 and 10. So this is inhibitor of clotting factor number 2, 7, 9 and 10 by inhibiting one enzyme. We call it vitamin K oxidoreductase enzyme. So by inhibiting vitamin K oxidoreductase enzyme, warfarin is a drug that will inhibit the clotting factor 2, 7, 9 and 10. Now this medicine monitoring is done by INR or the prothrombin time. Medicine monitoring is done by INR and prothrombin time, and this medicine antidote is vitamin K1. Medicine antidote is vitamin K1. The drug name is warfarin. Right? Now, where do we use anticoagulants? Anticoagulants ko we use for the venous thrombi. This is given for the prevention of venous thrombi. So we can use this medicine for venous thrombi prevention. Like for example, this is given for DVT. This is given for pulmonary embolism. This is given for prosthetic heart valve patient. This is given for atrial fibrillation patients. So wherever we have the venous thrombi present, like the DVT, pulmonary embolism, prosthetic heart valve, atrial fibrillation, we prefer to use anticoagulants. So antiplatelets are given for arterial thrombi prevention, and anticoagulants are given for venous thrombi prevention. Now, where do we use thrombolytics? Now, thrombolytics are used to dissolve the already present clot. So, this is given to dissolve the already present clot. So, if the clot is already present and you want to dissolve the already present clot, thrombolytics are the medicines that are given to the patients. So, thrombolytics are the medicines which are given to the patients to dissolve the already present clot. Now, all these medicines end with the word T place. All these medicines end with the word T place, like we have a drug Altiplase. We have a medicine like Tinectiplase. So all these medicines end with the word T place, but we have a medicine that we obtain from a natural source, Streptococcus bacteria. We call it a streptokinase. Now all these medicines are activator of tissue plasminogen. They will act like a tissue plasminogen activator. So medicines will act like a tissue plasminogen activator. They will convert plasminogen to plasmin. So these medicines will convert plasminogen to plasmin. And once they convert plasminogen to plasmin, plasmin will dissolve the clot. So plasmin can dissolve the clot. So these medicines are given to dissolve the clot. And the antidote of this medicine is IACA. Medicines का antidote है IACA, which is also known as epsilon amino caproic acid. So epsilon amino caproic acid is an antidote of choice. So this is an antidote of choice. The other antidote is tranexamic acid. One more antidote is tranexamic acid that is used. Right. So these are the medicines which are known as a blood thinners. So three blood thinners we have covered. Medicines are antiplatelets, anticoagulants, and we have a medicines we call them thrombolytics. So topic number 13 we have covered is uh, blood thinners. Now we have a topic number 14. Now topic number 14 is based on chelating agents. So chelating agents pe they can ask you the questions. So they will give you the toxicity of any heavy metal and they will ask you the chelating agent of choice. So this has already been covered in your forensic medicine class. So this chelating agent topic is already been covered in forensic medicine class. So just quickly tell me which medicine we can use for iron toxicity. So iron toxicity में which drug is given by IV route, which medicine given by oral route. Now copper toxicity, copper का overloading में which medicine we can use. So copper toxicity में we can use the medicine like penicillamine. We can also use the medicine like zinc. So zinc and penicillamine given for copper toxicity. Iron toxicity में we can use the medicine desferoxamine. So desferoxamine given by IV route and the medicine name is deferasirox. So deferasirox, deferipron. So these medicines given by oral route. So deferipron, deferasirox given by oral route and intravenous route से desferoxamine. Copper toxicity में we can use penicillamine and zinc. So in this way you should be knowing. Who will tell me which medicine is given for lead toxicity? Lead toxicity में कौन सा drug use होता है? Yes, here we can use EDTA. So EDTA can be used for lead toxicity. So in this way, you people have to remember this list of chelating agents and where do these medicines are used. So this is relevant for your exam. So topic number 14 is chelating agent, already covered in forensic medicine. So you people have to read about these drugs. Now topic number 15. Topic number 15 is based on treatment of myelosuppression. So treatment of myelosuppression. So which medicines we can use for myelosuppression? So whenever the bone marrow is suppressed, which medicine we can use? So whenever the WBC count is low, we can use a medicine to increase the WBC count. We call it filgrastim. So filgrastim is a medicine that is given to increase WBC count. Now when the platelet count is low, which medicine we can use? So platelet के लिए we can use the medicine like romiplostin. So we can use the medicine romiplostin. We can use the medicine like oprelvicin. So romiplostin, oprelvicin, L-trombopag. So these three medicines we can use to increase the platelet count. Now when the RBC count is low, to increase the RBC count, we can use the medicine darbepoetin. And for the same reason, darbepoetin is drug of choice for anemia associated with CKD. So anemia associated with CKD, darbepoetin is a medicine of choice. So darbepoetin is a medicine of choice for the to increase the RBCs in anemia associated with CKD. So topic number 15 that is important for your exam is the treatment for myelosuppression. Now topic number 16. So topic number 16 which is important for your exam, the medicines that we can use for GERD. So medicines that we can use for GERD. So we can divide these medicines in two classes. Medicines which can stop the acid production and medicines which can increase the peristalsis. So we can divide medicines in two classes. Medicines which can increase peristalsis, medicines which can stop the acid production. So which medicines can stop the acid production? That is proton pump inhibitors. These medicines are the drug of choice. Medicines को कहते हैं proton pump inhibitors. They are the inhibitor of H plus K plus ATPase pump. So they are the irreversible inhibitors. They are the irreversible inhibitors of H plus K plus ATPase pump. Irreversible inhibitors. We can also use H2 receptor antagonist. We can also use H2 histamine 2 receptor antagonist. The drug name is ranitidine. Now we have a medicine which is a potassium channel, right? So potassium channel activity blocker. So potassium channel का activity blocker. The drug name is vonaprazan. So vonaprazan is a new medicine. It's important for your exam. So this medicine is a potassium channel, right? Potassium channel competitive blocker or potassium channel acid blocker. So potassium channel acid blocker, potassium channel competitive blocker, whatever you want to remember. So vonaprazan is a new medicine. This is used for GERD. Now, which medicines are given to increase peristalsis? So we have a dopamine 2 receptor blockers. We have two medicine which are dopamine 2 receptor blocker. First medicine is known as metoclopramide. Medicine is known as metoclopramide. Now, metoclopramide can block dopamine pathway. This will cross blood-brain barrier. Now, after crossing blood-brain barrier, this medicine can result in CNS side effect. So, medicine is can result in CNS side effect. Metoclopramide can cross blood-brain barrier, can result in CNS side effects. So, in CNS side effect, this medicine can result in extrapyramidal symptoms. This medicine can result in muscle dystonia. So, can result in muscle dystonia, can result in extrapyramidal symptom. We have the other medicines belong to this class like domperidone. So, domperidone does not cross blood-brain barrier. So, this medicine will not cause this side effect. Now we have a second medicine which is a prokinetic medicine. इन्हें हम बोलते हैं prokinetics. So these medicines are known as prokinetic drugs. They will increase peristalsis. So we have a dopamine 2 blocker. We have a medicines that will act on serotonin 4 receptors. So all medicines which act on serotonin 4 receptors, they end with the word pride. So medicines end with the word pride. Examples are like cisapride and the mosapride. Medicines are like cisapride and mosaprides. Third is macrolides. Medicines को कहते हैं macrolides. Macrolides में we have a erythromycin. Erythromycin is an antibiotic. It has a prokinetic property by acting on motilin receptor. So this will act on motilin receptor, and after crossing by activating the motilin receptor, this medicine can increase the GI motility. So we call them macrolides. So these medicines we can use for GERD. Topic number 16, GERD is important for your exam. Now moving on to topic number 17. Topic number 17, which is important for your exam. Medicines which are given for chemotherapy-induced nausea vomiting. So chemotherapy-induced nausea vomiting, this is maximally seen with cisplatin. So cisplatin is a medicine that has a maximum risk of causing nausea and vomiting. We call it chemotherapy-induced nausea and vomiting. Now this vomiting can be of two types. This vomiting can be seen within 24 hours of drug intake. We call it early chemotherapy-induced nausea vomiting. This vomiting can be seen after 24 hours of drug intake. We call it late chemotherapy-induced nausea vomiting. Now for early vomiting, the best medicines are 5-HT3 receptor antagonist. Very good. So Dr. Happy. So 5-HT3 receptor antagonists are the best medicines. And the medicines which are the best medicines for late vomiting, we call them neurokinin 1 receptor blocker. So neurokinin 1 receptor blocker, we also call them substance P inhibitors. So here we have an example of a drug like aprepitant. So example of the drug is aprepitant. Now 5-HT3 blocker, all these medicines end with the word citron. So pelinocitron is the most efficient medicine. So pelinocitron is a drug which has the maximum efficacy. So among all drugs, pelinocitron has maximum efficacy. So this topic you people are supposed to read in detail. Topic number 17, I have covered superficially. You people are supposed to read in detail. Now topic number 18, which is important for your exam, is a diarrhea. So which medicines we can use for diarrhea? So drugs that we can use for diarrhea, topic number 18. So topic is diarrhea. So you people have to tell me which medicine is best medicine for infective diarrhea. What is the drug of choice for infective diarrhea? What is the drug of choice for non-infective diarrhea? What is the drug of choice for uh, traveler's diarrhea? And what is the drug of choice for secretory diarrhea? So we have four types of diarrhea: infective, non-infective, traveler's diarrhea, secretory diarrhea. Yes, infective diarrhea में we give fluoroquinolones. So fluoroquinolones are the best medicines for infective diarrhea. Non-infective diarrhea, we use loperamide. So we use loperamide. Second drug of choice is octreotide. So loperamide is a drug of choice, which is an opioid. Octreotide is used in refractory cases. Now for traveler's diarrhea, the best medicine is azithromycin. Azithromycin is a best medicine. Rifaximin can also be used. Rifaximin can also be used. For secretory diarrhea, we give a medicine octreotide. Now, what is octreotide? Octreotide is a somatostatin analog. Octreotide is a somatostatin analog. So these medicines we can use for secretory diarrhea. So four types of diarrhea you people are supposed to read in detail, right? So topic number 18 is diarrhea that can be asked in your exam. Moving on to topic number 19. So topic number 19, which can be asked in your exam, is from autocoids. So this has already been covered in your medicine class, rheumatoid arthritis. So medicines that we can use for rheumatoid arthritis, we call them DMARDs. So DMARDs are the medicines that we use for rheumatoid arthritis. So rheumatoid arthritis mein we can use the medicines DMARDs. So what is the drug of choice? So drug of choice is methotrexate. Drug of choice is methotrexate. Its mechanism of action, dihydrofolate reductase enzyme inhibitor. Mechanism of action, dihydrofolate reductase enzyme inhibitor. The drug name is methotrexate. Now, the important side effect of this medicine is bone marrow suppression, can cause pulmonary fibrosis, liver fibrosis. So, can result in pulmonary fibrosis, liver fibrosis. Now, these side effects we can avoid by giving leucovorin. So, leucovorin, which is also known as folinic acid. Leucovorin, also known as folinic acid. So, this medicine we can use. We can also use a medicine hydroxychloroquine sulfate. Hydroxychloroquine sulfate can also be used in this patient. And the important side effect of this medicine is bullseye retinopathy. So bullseye retinopathy is an important side effect of this medicine, that is of HCQS. We can also use a medicine sulfasalazine. Sulfasalazine can also be given. Now we have some biologicals. That is also been used for rheumatoid arthritis. For example, we have a TNF alpha blocker. We have a medicine which is TNF alpha blocker, like the drug name is adalimumab and infliximab. So infliximab, adalimumab, TNF alpha blocker. We have a interleukin 6 inhibitor. So interleukin 6 inhibitor, drug name is tocilizumab. Now the medicine which is Janus kinase inhibitor. Medicine which is Janus kinase inhibitor. हाँ, Janus kinase inhibitor कौन से हैं बताओ बच्चे, ये इंपॉर्टेंट है आपके लिए. The medicines which are Janus kinase enzyme inhibitor given by oral route. Medicines are Janus kinase enzyme inhibitor. Medicines are tofacitinib. So one medicine is tofacitinib. One more medicine is baricitinib. So tofacitinib, baricitinib, Janus kinase enzyme inhibitor. So these medicines are important for your exam. So topic number 19 is rheumatoid arthritis. Now moving on to topic number 20. So topic number 20, which can be asked in your exam, is gout. So medicines which are given for gout. Now the medicines which are given for acute gout. So which medicines we can use for acute gout? which medicines we can use for maintenance treatment. So acute gout में बच्चे best medicines are NSAIDs. So best medicines are NSAIDs, like we have a drug diclofenac. So diclofenac we can use. We can also use this medicine colchicine. We can also use steroids. So colchicine, steroids and NSAIDs can be used for acute attack. Now for maintenance treatment, the best medicine is allopurinol. So allopurinol is the best medicine that can be used. Now this is a xanthine oxidase enzyme inhibitor. This medicine is xanthine oxidase enzyme inhibitor. The drug name is allopurinol. One alternative of this medicine is febuxostat. Alternative is febuxostat. We can also use artificial uricase enzyme. So we can also use uricase enzyme. Drug name is P-gluticase. So you can see P-gluticase ka name ends with the word case. So it's a artificial uricase given by IV route for gout. So P-gluticase, artificial uricase can be given for gout. So these medicines we can use. We can also use other medicines like probenecid. ठीक है, तो gout is one more topic which is relevant for your exam. Now moving on to topic number 21. So topic number 21 that can be asked in your exam, that is the drug for migraine. So this topic is already we covered in your medicine class. So this has already been covered in your medicine class. So from the medicine class, please read this topic, drugs for migraine. ठीक है, तो migraine के acute attack में which drug is used, and for prophylaxis which drug is used. So can anyone tell me what is the best medicine for prophylaxis of migraine? So prophylaxis of migraine, which medicine is best medicine? So Dr. Stanley has given the correct answer, propranolol. So propranolol is the best medicine for prophylaxis of migraine. Now which medicines we can use for acute attack? हाँ, acute attack में best medicines, like medicines that we can use are NSAIDs. So NSAIDs में naproxen can be used. We can also use triptans. We can also use triptans. We can also use ergot derivatives. So ergot derivatives and triptans. These medicines will act on serotonin 1B, 1D receptor. But what is the problem that we are facing? The problem that we are facing is these medicines can cause vasoconstriction. These medicines can cause important side effect as vasoconstriction and can result in ischemia, can result in gangrene. So what we people have done, we have discovered CGRP inhibitors. So CGRP inhibitors are the medicines that will not cause vasoconstriction as a side effect. So all these medicines end with the word GPENT. So all these medicines end with the word GPENT. So one example is like rimegepant. So one example is like rimegepant that will not cause vasoconstriction. So they will not cause vasoconstriction as a side effect. So this topic, migraine, already covered in your medicine class, important for your exam. Now I will just highlight the topics because I don't have time to cover all the topics for you people. So topic number 22, which can be asked in your exam, is from psychiatry. So this has already been covered in your psychiatry class. The topic is for drug de-addiction. So this you people will cover from your psychiatry class. The topic of drug de-addiction is important for your exam. Like they can ask you which medicine we can use for opioid de-addiction. ठीक है? So you should be knowing about the drugs that we use for opioid withdrawal, opioid de-addiction and all. Now after this topic number 22, topic number 23 that can be asked in your exam is opioids. So opioids is also the important topic. So opioids will act on mu receptor, and by acting on mu receptor, opioids are used as a painkiller. So they are the wonderful painkillers. And you must be knowing, when we give opioids to our patients, tolerance is seen against all actions. When we use opioids, tolerance can be seen against all actions of opioids except two. So tolerance can be seen against all actions of opioids except two actions. One is known as meiosis and one is known as constipation. So except from meiosis and constipation, tolerance can be seen against all actions of opioid. So this topic is already been covered in your anesthesia class. This is an overlapping topic with pharma and anesthesia. Now, topic number 24, which can be asked in your exam. So that is based on neuralgia. So they will give you the treat one neuralgia and they will ask you the drug of choice for neuralgia. So who will tell me which medicine we can use for diabetic neuralgia? So which medicine we can use for diabetic neuralgia? Which medicine we can use for trigeminal neuralgia? So anyone can answer this question. What is the drug of choice for trigeminal neuralgia? What is the drug of choice for diabetic neuralgia? What is the drug of choice for post-herpetic neuralgia? So which medicine is best medicine for post-herpetic neuralgia? Which medicine is drug of choice for spinal cord injury? So spinal cord injury neuralgia, like sciatica. Patient को sciatica हो रहा है. Patient has got a disc prolapse. So which medicine we can use? So diabetic neuralgia में we can use medicines like pregabalin, gabapentin, or we can use an antidepressant duloxetine. So duloxetine is an antidepressant belong to a class SNRI. So pregabalin, gabapentin. Trigeminal neuralgia में carbamazepine. So carbamazepine, oxcarbamazepine is drug of choice. Post-herpetic neuralgia, tricyclic antidepressants. So tricyclic antidepressant, like the drug name is nortriptyline. So nortriptyline is the best medicine to be used. We can also use medicines like pregabalin, gabapentin. And for spinal cord injury, we can use pregabalin, gabapentin, or we can also use tricyclic antidepressants. So this topic is neuralgia, topic number 24, relevant for your exam. Now moving on to the next topic, topic number 25. So topic number 25 is antidepressants. So antidepressants में there is a class of medicines SSRI. So this class of medicine is important for your exam. So the medicines which belong to this class, medicines names are escitalopram, medicine name is paroxetine, right? Medicine name is fluoxetine, medicine name is fluvoxamine. So this particular class is important for your exam. Escitalopram, paroxetine, fluoxetine, fluvoxamine. So these medicines are the drug of choice for depression, drug of choice for all type of anxiety disorders. So all type of anxiety disorders, all type of depression, these medicines are the best medicine. And the biggest drawback of this medicine is they will cause maximum sexual dysfunction. So these medicines will cause maximum sexual dysfunction among all antidepressant. It's the biggest drawback of this medicine. As a result of that, we can use the atypical antidepressants. So what is the alternative? We can use atypical antidepressant medicines. So atypical antidepressants, like we have a drug bupropion, we have a drug like mirtazapine. So we have atypical medicines like bupropion and mirtazapine. These medicines will not cause sexual dysfunction. So these medicines will not cause sexual side effect. Yes, इनमें maximum sexual side effect होता है anorgasmia. So patient has difficulty in achieving the orgasm. Anorgasmia is an important side effect. So this topic you are supposed to read in detail in antidepressants, that is an SSRI. Now moving on to topic number 26. So topic number 26, which is relevant for your exam, is a second generation, or we call them atypical antipsychotic. So second generation or the atypical antipsychotic medications. Second generation and atypical antipsychotic medicine, where the clozapine is an most important drug for your exam. So who will tell me clozapine के side effects क्या हैं? So what are the side effects of drug clozapine? So the important drugs are clozapine. We have a drug risperidone. We have a drug like ziprasidone. So all these medicines are the second generation medicines. We have a medicine like aripiprazole. So aripiprazole, ziprasidone, risperidone, clozapine. These are the medicines which are second generation atypical antipsychotic medicine. So the important side effect of clozapine is agranulocytosis. So one of the important side effect of this medicine is agranulocytosis. This medicine can also cause cyalorrhea, can result in seizures, can result in seizures, can result in myocarditis. So medicine can lead to four side effects that we can remember with the mnemonic MAS. Mnemonic is MAS, myocarditis, agranulocytosis, seizures, and cyalorrhea. Risperidone में guys, please remember, this will cause maximum extrapyramidal symptom. Maximum extrapyramidal symptom caused by risperidone. Ziprasidone will cause minimum weight gain. Minimum weight gain, but maximum QT prolongation. Now, aripiprazole has overall minimum side effects. So, aripiprazole is a drug which has minimum overall side effects. So, this is topic number 26, important for your exam, atypical antipsychotic. Because of lack of time, I'm not able to cover these medicines in detail. So, people have to read by yourself. Now, moving on to topic number 27. Topic number 27 is from endocrine diabetes mellitus. So diabetes में you people have to read the medicines like metformin. So metformin is important. SGLT2 inhibitors. SGLT2 inhibitors can be asked in your exam. So this we have already covered. Now the third medicines are GLP-1 analogs. Medicines are GLP-1 analogs. So here the examples of the medicines are liraglutide. One more example is semaglutide. So liraglutide, semaglutide are the GLP-1 analogs. And one more topic is DPP-4 inhibitors. Medicines which are known as DPP-4 inhibitors. So all these medicines end with the word gliptins. So examples are like linagliptin, sitagliptin, all these medicines are important. Okay. Now please tell me, out of this medicine, who will tell me which drug can cause lactic acidosis? Which medicine has a most important side effect as lactic acidosis? So out of metformin, out of this gliflozins, which drug will cause lactic acidosis? Out of liraglutide, semaglutide, linagliptin, sitagliptin, which drug will cause lactic acidosis? So metformin is a drug that has an important side effect as lactic acidosis. This is the medicine which has an important side effect as lactic acidosis. Okay, now can you please tell me which medicines are the best medicines for obesity? इनमें से कौन सा ड्रग है जो obesity के लिए approved है? Which medicines have become the best medicines for obesity these days? So obesity में these medicines have got approval. So semaglutide, liraglutide, these medicines are become the first line medicines for obesity, right? Now semaglutide is a drug that can be given by oral route, can be given by subcutaneous route. And regarding the gliptin, please remember all gliptins dose need to be reduced in patients of CKD. All medicines dose need to be reduced in CKD except the linagliptin. Linagliptin is the only medicine where the dose need not to be modified. This drug is purely metabolized by the liver. So topic number 27 is diabetes mellitus that you should be knowing for your exam. Topic number 28 is you should be knowing about the drug of choice for hyperthyroidism. So details of the drugs usually they don't ask. So hyperthyroidism ka drug of choice only is important for your exam. So which medicines is a best medicine for maintenance treatment? Which medicine is best medicine for crisis? So crisis में we use propyl thiuracil. So propyl thiuracil is a best medicine. It is given along with propranolol. Given along with propranolol, this is for the thyrotoxicosis. Condition ko we call thyrotoxicosis. Now for maintenance treatment, which medicine is best medicine? So that depends upon whether the patient is non-pregnant or pregnant. So in a non-pregnant patients, maintenance treatment में best medicine is carbimazole. Carbimazole is a best medicine. So here the important side effect is again agranulocytosis. Now pregnant females में that depends on the trimester. If the female is in first trimester, we will give propyl thiuracil. The female is in second and third trimester, we will prefer to use carbimazole. So carbimazole in second and third trimester. First trimester we give propyl thiuracil. So you should be knowing about the this topic hyperthyroidism. Ke mainly they ask you the side drug of choice only. So drug of choice is asked. So topic number 28 based on hyperthyroidism. Now topic number 29 is based on osteoporosis. So drugs for osteoporosis. So osteoporosis के drugs को we can divide in two categories. So medicines can be anabolic drugs and medicines can be anti-resorption drugs. So we have two types of medicines, anabolic drugs and the anti-resorption drugs that is given for osteoporosis. Now anabolic drugs are those medicines that will increase osteoblast activity. So medicine that will increase osteoblast activity. So here we have a drug teriparatide. So teriparatide is a parathyroid hormone analog. So teriparatide is a parathyroid hormone analog. This medicine is contraindicated if the patient is having a bone cancer. So in patients of bone cancer, this is contraindicated. So teriparatide is an anabolic drug that will result in bone formation by increasing osteoblast activity. Now the second class of medicines are those which can inhibit the osteoclast activity. We call them the anti-resorption drugs. So here the drug of choice for osteoporosis is bisphosphonates. So bisphosphonates, all medicines end with our dronate. All medicines end with our dronate. We call them bisphosphonates. So these are the anti-resorption drugs. These are the anti-resorption drugs. We call them bisphosphonates. They inhibit the osteoclast activity. Right. So here we have medicines like alendronate, ibandronate, zoledronate. So these medicines are important for your exam. Right. So topic number 29 based on osteoporosis. Now moving on to topic number 30. So topic number 30 that is important for your exam is a growth hormone. So growth hormone problem, acromegaly. So who will tell me which medicine is drug of choice for acromegaly? So drug of choice for acromegaly is medicine name is lenriotide. Medicine name is lenriotide or octreotide. So these medicines are the somatostatin analog. So we call them somatostatin analog. They are the best medicines for acromegaly, best medicine for gigantism. Now if the condition is not controlled, if the condition is not controlled by lenriotide or octreotide, we can add the second medicine. The second medicine is pegvisomant. Second medicine that we can add in the treatment is pegvisomant. Now what is pegvisomant? Pegvisomant is a growth hormone receptor antagonist. This is the growth hormone receptor antagonist medicine. The drug name is pegvisomant. So pegvisomant is a growth hormone receptor antagonist medicine that we can add in the treatment. So topic number 30 based on acromegaly, important for your exam. Now we are moving on to topic number 31. Right now, because of lack of time, I'm just writing down the topics for you. So topic number 31 is dose response curve. So that is from General Pharma. So dose response curve is important topic. So dose response curve mein, can you please tell me when there is a right shift of DRC? When there is right shift of DRC, what does it mean? अगर मेडिसिन का डोज रिस्पॉन्स कर्व is shifted towards right side, what does it mean? When there is a flattening of DRC, what does it mean? Flattening of DRC का मतलब क्या है? X axis को we use to calculate which parameter? Y axis we use to calculate which parameter? Right? And who will tell me what is the therapeutic index? So although there are 7 or 8 MCQs based on dose response curve, but I have just tried to discuss few. So right shift of DRC means that there is a presence of competitive blocker. Flattening of DRC means there is a presence of non-competitive blocker. X-axis is used for potency. So if a medicine has a left side DRC, it means medicine is more potent. Now y-axis is for efficacy. Y-axis is used to calculate the medicine efficacy. So more is the height, more is the height, more is the efficacy. Less is the height, less is the efficacy. Therapeutic index is LD50 upon ED50. Lethal dose 50 and effective dose 50 का ratio we call therapeutic index. It's an index of drug safety. It is an index of drug safety. So in this way, you have to read this topic in detail. We call it a dose response curve. Now moving on to topic number 32. So topic number 32 that is relevant for your exam, that is numericals. So numericals of general pharma. So there are total 5 formulas that you people have to understand. So first formula is of loading dose or any dose they ask you. So loading dose or any dose depends upon volume of distribution, plasma concentration divided by the bioavailability. So they will ask you कि loading dose depend करता है किस पर? So loading dose or any dose of the drug depends upon 3 parameters: volume of distribution, plasma concentration, and the bioavailability. And if you're giving the medicine by IV route, the bioavailability become +1. The bioavailability become +1. So इस केस में the dose is equal to volume of distribution multiplied by plasma concentration if you are giving the medicine by IV route. Next is they will ask you the maintenance dose, or they will ask you the rate of elimination, maintenance dose or rate of elimination, or they can ask you the dosing rate. So if they will ask you anything, it means the same. So dosing rate, rate of elimination is same thing. Maintenance dose is same thing. That depends upon clearance and the plasma concentration. So this depends upon clearance and the plasma concentration. Now from the above two formulas, we can find out the value of volume distribution. You can see कि volume distribution को कैसे calculate करेंगे. So volume distribution is given by dose divided by plasma concentration if we are giving the medicine by IV route. If you are giving the medicine by IV route, then in that case the bioavailability is +1. So this is the volume distribution. And from the above formula, what is the clearance? Clearance is given by rate of elimination upon plasma concentration. So from this formula, we have calculated the clearance formula. Number 5, what is half-life of a drug? So half-life of the medicine is 0.693 divided by K, where the K is known as the elimination constant. K is known as the elimination constant, and K का value होता है clearance upon volume of distribution. So when I put the value, this comes out to be 0.693 volume of distribution divided by clearance. So when I put the value of K, this comes out to be this formula: 0.693 multiplied volume distribution and clearance. So these are the 5 or 6 formulas which are relevant for your numericals. That is topic number 32. Now moving on to topic number 33. So topic number 33, which can be asked in your exam, is liver enzyme inducers and liver enzyme inhibitors. You should be knowing the names of medicines which are liver enzyme inducers and inhibitors. So during our lecture also, we have discussed various mnemonics of medicines which are liver enzyme inducers, medicines which are liver enzyme inhibitors, because these are responsible for drug interactions. So they can ask you one MCQ based on drug interaction. So drug interaction MCQ is based on liver enzyme inducers or inhibitors. So if you have attended our regular batch, you must be knowing liver enzyme inducers का mnemonic we have made is Cargas, and liver enzyme inhibitors का mnemonic we have made is Peacock, where the most important drug in inducer is rifampicin. So rifampicin is a TB drug which is a very strong liver enzyme inducer, and here the inhibitors are antibiotics. यहाँ पर कुछ एंटीबायोटिक्स के नाम है, लाइक इरिथ्रोमाइसिन. Erythromycin is an antibiotic. It's a liver enzyme inhibitor. Ciprofloxacin is a liver enzyme inhibitor. Clindamycin is liver enzyme inhibitor. Clarithromycin is liver enzyme inhibitor. So we have medicines which are liver enzyme inhibitors. We have medicines which are liver enzyme inducers. So you should be knowing the list of medicines which are liver enzyme inducers and inhibitors. So if you know this list, then one MCQ that is based on drug interaction can be solved. So please remember, this is important topic. I am not going in detail because of lack of time. So please read this topic by yourself in detail. Now topic number 34. Topic number 34, which is important for your exam, is types of receptors. So they can ask you the types of receptors. So what are the types of receptors we have? So we can have the nuclear receptors, you must be knowing. So which receptors are present in nucleus? Which receptors are present in cytoplasm? Which receptors are present in membrane with kinase enzyme activity? And which receptors are present in membrane having a G protein activity? We call them G protein coupled receptors. So we have total 4 types of receptors: nuclear receptors, cytoplasmic receptor, membrane receptor with kinase enzyme activity, and we have a G protein coupled receptor that is again present in membrane. So in our lectures, we have made a mnemonic. The receptors which are present in nucleus, the mnemonic is TAPE. So thyroid hormone receptor is nuclear receptor. Vitamin A receptor is nuclear receptor. PPAR receptor is nuclear receptor. And the receptor of estrogen is a nuclear receptor. So mnemonic is TAPE. Now cytoplasm mein, we have a receptors of all steroids. So all steroid, we have a cytoplasmic receptor. Vitamin D has cytoplasmic receptor. So kinase receptors, you can remember this mnemonic PIG. So PIG में we have a prolactin. So prolactin का receptor, insulin receptor, growth hormone receptor. So insulin receptor, growth hormone receptor, prolactin receptor, membrane receptor with kinase enzyme activity, and we have a G protein coupled receptor. So all other drugs will act on G protein coupled receptor. Now G protein coupled receptor में जो G alpha है, that's a most active form. Most active form of the receptor is a G alpha form. ठीक है, तो G alpha form is the most active form of the receptor. Now this can be G alpha S stimulatory type. This will increase the level of cyclic EMP. We have a G alpha I which is inhibitory type. This will decrease the cyclic EMP. And we have a G alpha Q or not 0. So G alpha Q or 0, this will increase IP3 and DAG level. राइट, तो इन्हें बोलते हैं सेकेंडरी मैसेंजर्स. सो जी अल्फा एस का सेकेंडरी मैसेंजर है साइक्लिक एएमपी दैट इज इंक्रीज्ड. जी अल्फा आई इज इनहिबिटरी दैट विल डिक्रीज साइक्लिक एएमपी. जी अल्फा क्यू secondary messengers are IP3 and DAG. This information is required for the exam. Topic number 34 based on types of receptors. Right. Now after that, this general pharma, we have the antimicrobials. So topic number 35. So topic number 35 based on antibiotic classification. So antibiotic classification is important for your exam. You should be knowing which medicines are cell wall inhibitors. So you must be knowing the important one, beta-lactam antibiotics. So beta-lactam antibiotics, vancomycin, cell wall inhibitors. Now you should be knowing the medicines which are protein synthesis inhibitors. So protein synthesis inhibitors can be of two types. Some medicines will act on 30S ribosome. Some medicines will act on 50S ribosome. So in your exam, they have already asked you कि tetracyclines act on which ribosome? Answer is they will act on 30S ribosome. Now macrolides will act on 50S ribosome. Linezolid will act on 50S ribosome. We have a folic acid pathway inhibitors. So folic acid pathway inhibitors, example of the drug is cotrimoxazole. Right? So cotrimoxazole is a medicine that is a folic acid pathway inhibitor. And finally, we have the medicines which will act on the nuclear pathways, nucleus material inhibitor. So we have a fluoroquinolones. So fluoroquinolones are the DNA gyrase inhibitors. We have a rifampicin. So rifampicin is a medicine that is a folic acid pathway inhibitor. And finally, we have the medicines which will act on the nuclear pathways, nucleus material inhibitor. So we have a fluoroquinolones. So fluoroquinolones are the DNA gyrase inhibitors. They are the DNA gyrase inhibitors. We have a rifampicin. Rifampicin is a medicine which is a RNA polymerase inhibitors. So this is the RNA polymerase inhibitor, rifampicin. Metronidazole, this is also a direct DNA inhibitor. So all these medicines classification is important. So topic number 35 based on antibiotic classification. Topic number 36. So topic number 36 based on antibiotic indications. So this is comparatively less important. Comparatively less important for your exam. So in case you can read the antibiotic indications, it's good. So you can read the indications of beta-lactam antibiotics. So beta-lactam antibiotics indications are important. Azithromycin indications are important. Linezolid indications are important. Fluoroquinolone, doxycycline. So these are the antibiotics where the indications can be asked in the exam. So topic number 36 based on antibiotic indications. Topic number 37. Topic number 37 is from antifungal. Antifungal में they mostly ask you the medicine liposomal amphotericin B. So liposomal amphotericin B, drug of choice for mucormycosis. So they can ask you which medicines we can use for mucormycosis. So mucormycosis में I can use liposomal amphotericin B as a best medicine. I can also use a medicine like posaconazole. I can use the medicine like posaconazole. I can also use the medicine like isavuconazole. So isavuconazole, posaconazole, liposomal amphotericin B is the drug of choice. They can ask you which medicine is best medicine for cryptococcal meningitis. So cryptococcal meningitis में again liposomal amphotericin B is a drug of choice. We can also use a medicine flucytosine. So flucytosine, liposomal amphotericin B given for cryptococcal meningitis. They can ask you what is the drug of choice for invasive aspergillosis. So what is the best medicine for aspergillosis? So invasive aspergillosis, guys, please remember voriconazole. Voriconazole is the best medicine. Liposomal amphotericin B is the second best medicine for invasive aspergillosis or just aspergillosis given to you. So all these things they can ask you in the exam, antifungal drugs. So these drugs are important like liposomal amphotericin B, voriconazole, these drugs are important. Topic number 38. So topic number 38, which can be asked in your exam, which you have already covered in PSM class. So in PSM class, you have already covered the malaria treatment. So malaria treatment guidelines. So as per the program, National Vector Borne Disease Control Program. So National Vector Borne Disease Control Program that is already been covered in PSM class. So this guidelines you people have to read in topic number 38. Topic number 39, HIV treatment. So HIV treatment guidelines that is already been covered in your PSM class. So PSM may already been covered. What is a what is the treatment for HIV? What is a post-exposure prophylaxis? What is a pre-exposure prophylaxis? So post-exposure prophylaxis, pre-exposure prophylaxis, how we can stop the vertical transmission, how we can stop the transfer of infection from mother to fetus, vertical transmission को कैसे रोक सकते हैं? So all these things we have covered in PSM class. So that is important. Like there are many things in pharma which are overlapping with the subjects. Topic number 40 is based on TB drugs. So TB drugs में mostly they ask you the medicines like HRZD. So HRZD medicines को you people have to read in detail. Apart from that, there is a regimen, we call it a B-PALM regimen. So B-PALM regimen में जो drugs हैं, these are important for your exam. So medicines which are part of your B-PALM regimen, these medicines are important for your exam. Now out of these medicines, like one drug is bedaquiline. So can any one of you tell me the mechanism of action? What is the mechanism of action of bedaquiline? What is the mechanism of action of pretomanid? What is the linezolid? So bedaquiline का mechanism of action, this is ATP synthase enzyme inhibitor. And the important side effect is QT prolongation. Important side effect is QT prolongation. Pretomanid is cell wall inhibitor. It is a cell wall inhibitor where it is inhibitor of mycolic acid. This is inhibitor of mycolic acid. An important side effect is again QT prolongation. Now, linezolid is protein synthesis inhibitor. Important side effect is serotonin syndrome. Important side effect is serotonin syndrome, bone marrow suppression, and the neuropathy. So, important side effect which we have discussed in class also BSNL. So, BSNL का full form, bone marrow suppression, serotonin syndrome, neuropathy, and the lactic acidosis. So, four side effects this medicine can cause, linezolid. So, these medicines are important for your exam. This is topic number 40. Now, after topic number 40, the last topic, topic number 41. The last topic is based on anti-cancer drugs. So, recently they have started asking questions on monoclonal antibodies. You should be knowing about the monoclonal antibodies, like where do we use trastuzumab? So, trastuzumab is HER2 new inhibitor. So, where do we use this medicine? You should be knowing. Now, we have a drug, imatinib. Now, imatinib is ABL. Imatinib जो drug है, that's a ABL BCR tyrosine kinase inhibitor. Now, where do we use this medicine? So, imatinib is drug of choice for CML, and trastuzumab is a drug that we use for breast cancer. We use it for breast cancer. So, some important commonly used monoclonal antibodies you should be knowing in anti-cancer topic. Okay, anti-cancer topic में you should concentrate on monoclonal antibodies. Apart from that, cisplatin, methotrexate. So, these drugs you can read. Doxorubicin. So, these medicines are important for exam. Okay. So, these are the total 41 topics which I have able to take out from the whole course of pharmacology for you people. So, if you concentrate on these topics, surely you will be successful in the exam. And guys, just concentrate on these topics and keep on doing PYQs and MCQs side by side. Because doing PYQs are very important, because ultimately you people have to attempt the PYQs over there. You have to attempt the MCQs over there. So if you don't try, if you don't practice the MCQs, all these things, all this theory and everything is wasted. So our suggestion is concentrate on the important topics side by side, keep on doing MCQs and keep on giving maximum GTs as much as possible. You have very less time now, right? So concentrate on GTs as well as and the MCQs. That's all from my side, guys. All the best for your exam. Keep studying hard. In case you have any problem, any doubt, you can directly contact me on this number, right? So you can WhatsApp me on this number for any query you people have, or you can also contact me on Telegram in the FMG group of DBMCI, right? So for any query, you can contact me, right? Take care, guys. All the best for your studies and keep working hard. And my all wishes are with you. And once you clear your exam, please inform me. So we'll have a party together. Okay. Take care of yourself, guys. Good night.